So today we're going to talk about it is possible innovations in patient-centered healthcare, just in case you're wondering if you're in the right place. My name is Judith Bentkover. I'm a professor at the School of Public Health and the executive and academic director of EMHL. EMHL, the Executive Master of Healthcare Leadership Program, is all about transforming leaders and transforming healthcare. We are immensely proud of this year's graduating class, EMHL class of 2016, who devoted their time and efforts to very important issues that need fixing, such as getting the right care to the right people at the right time. Since we choose students who believe that their work needs to embrace their passion, we are confident that you will enjoy interacting with our two student speakers today. Great students, passionate leaders, and a source of great pride to EMHL. Dr. Timothy Bain is co-founder and medical director, Bain Complete Wellness, co-founder and medical director of Saddlebrook Sports Performance, the world's only destination professional athlete rehabilitation and performance center. He's team physician for the Tampa Bay Lightning, and he came to EMHL to learn how other people were approaching healthcare and how he could take that knowledge to apply to his own ideas for entrepreneurial activities. And he came for networking beyond the Lightning, to get out of Tampa, to get his ideas out. And he came for street creds. So he's not just a chiropractor, he's now a Brown University graduate. Miss Birdy Lifson-Pompan, co-founder and CEO, Clear Health Advisors. That's a company dedicated to helping patients, helping them navigate through the maze of our healthcare system. Her company has the literal mission to reduce the rates of misdiagnosis, increase the speed and accuracy of correct diagnoses, and improve patient care experiences by aiding patients and facilitating access to the most appropriate specialists and treatment options. Birdy enjoyed great success in the business world as an agent to the stars in Beverly Hills. Unfortunately, she had her own personal experience with suboptimal health care. She watched her family and friends have similar unfortunate experiences. And then she decided to understand the business of healthcare that only medical leaders understood. She took that information and knowledge in her skill set and acted upon all of that together. Her story's impressive. Indeed, a television show was created to tell her story. As they will illustrate with their own cases, which, by the way, were their critical challenge projects to meet the requirements of the EMHL students. So you could say it started here at Brown. They then added all of their work undertaken through EMHL and really tried to transform medical research, diagnosis, treatment, patient care delivery, finance, put it all together to really help patients. Patient-centered care is not lost. Due to the efforts of these two students and their colleagues, the other EMHL class members of 2016, as well as those who came before and those who will come after, we see that the lack of patient-centered care who adversely affected people in the past will no longer continue to do so at such a high rate. We see that patients like Derek Jeter Ron Howard, the Tampa Bay Lightning team, as well as the LA resident who was hours away from having brain surgery with a neurosurgeon who had misdiagnosed her as having the wrong type of tumor. All of those horror stories will come to an end. The focus on patient care is here to stay, and we hope to spread that and disseminate it widely throughout our whole network. Dr. Bain and Ms. Lifson-Pompan will illustrate the innovative approaches that they have taken within the confines of traditional healthcare infrastructure, the models that they use to design their own business models that ensured not only patient-centered delivery care for all of us, but how they made it work for them. They have not only begun their businesses, but now they are well positioned to measure, document their results, and hopefully set the groundwork for all of you, because we're all going to be patients someday, to get good medical care. Following this discussion, I'd like to invite you all to ask questions and answers, and ask them hard ones, because they don't get their diplomas until tomorrow. So, I would like to invite you to meet with the School of Professional Studies hospitality staff in the campus center, 75 Waterman Street, room 225, to learn more about the Executive Masters of Healthcare Leadership Program. Thank you. Please join me in welcoming first Ms. Birdy Lips-Pompan.
I'm not good at IT, so we're going to get a little help here. Got to play to your strengths. And then how do I? Don't leave. Okay. Good morning, everyone. Thank you for coming. As Judy mentioned, my connection to healthcare is deeply personal. If you had asked me or anyone that knew me 10 years ago whether I'd be standing up at Brown in front of a group of people talking about patient-centered care, they would have thought you were crazy. Oh, they're telling me to talk louder. No one's ever told me to talk louder before. So my introduction to the world of healthcare is deeply personal. And not only was I horribly misdiagnosed in a system that I never believed this could happen, but 3 of my family members were also misdiagnosed. They say 1 in 5 patients are misdiagnosed, roughly 20% of the patient population. So the fact that I was misdiagnosed in a family of 5 made sense. But when 3 others were misdiagnosed, it just was too much of an alarming statistic to overlook what was happening with our healthcare system. And while I want to start by saying I have the utmost respect for physicians and all healthcare providers, there are people that have, for the most part, dedicated their entire lives to helping people. And I truly believe that is with best intentions. But I believe that even healthcare workers and physicians would agree there's a glaring problem in our system. And it shouldn't even be called a system. In fact, I refer to it as the morass of our healthcare world right now. So as Judy said, when I was faced with the realities of our healthcare system and having to navigate and also advocate on behalf of myself and my family members, I realized if this was happening to me and my family, and we had resources, I had access to the very best, the best doctors, the best hospitals, I could get into get into appointments in a timely manner, that this was happening all over the world to people that didn't have resources. And there was a defining moment in the care of my family members that I said, I can't do this job of representing writers and directors anymore, a career that I loved. I did it for over 20 years. I got to meet interesting people and fly all over the world and was even thanked at the Academy Awards. But I decided that people who really needed agents were the people that really needed help, where it really was a matter of life or death. So I came up with the idea of starting this company, Clear Health Advisors. So here are some of the alarming statistics that I learned throughout the course of this program. 12 million Americans are misdiagnosed every year. Misdiagnosis is the leading cause of all U.S. malpractice payouts. And one of the most upsetting statistic is 1 in 20 adult outpatients misdiagnosed will die because of the misdiagnosis. And in my own family, of those of us that were misdiagnosed, 2 of them resulted in death. And it was on the day that I was with my brother, who I was caring for, who had glioblastoma, not arguably one of the worst diagnoses there is, right? He was given 6 weeks to live. And I was determined to get him to the very best doctor, the one that could extend his life with quality of life. And I had gone with him to all of his appointments, and at the very last appointment, before I decided to change careers, I showed up with the list of all of the medications that all the different physicians had prescribed to him, and the neuro-oncologist said, well, who put him on potassium? And I said, let me check. His internist put him on potassium. And he said, well, that drug renders the oral chemotherapy that he's been taking to keep him alive completely useless. It negatively affects the potency of the oral chemotherapy. So essentially, it's as though he's been taking nothing for the last 2 months. And it was at that moment on that day, I knew I had to make a difference. I had to make a change. So now you're going to teach me how to click in here. I'm going to show you a quick news clip that explains what our company does, hopefully a little bit more articulately than I can do myself.
Questions about medical care have become so confusing, so exhausting, they've given rise to a new industry out there, healthcare consultants, private advocates, who promise to cut through the red tape and get you the treatment you need. Their contribution can save lives, but my team consumer investigator, Randy Mack, reports you need to do your homework, you need to do your research before you sign up.
I'm just kind of a cool mom. That's what people think.
Delina Hurwitz jokes now about a brain tumor that threatened her memory. Pink streak in her hair, symbolic of survival.
The misdiagnosis was the worst.
On the eve of brain surgery, she learned her tumor was no ordinary mass. It was a vascular or wet tumor and bleeding.
There are just too many barriers to getting good care now.
Panicked over what to do next, Hurwitz turned to healthcare consultants Dr. Valerie Uline and her partner, former Hollywood agent, Birdy Lips-Pompan.
Our job really is to confirm their diagnosis, identify the most appropriate specialist for their diagnosis, and then educate them on their treatment options. And we're a culture that has been trained not to question our doctors.
Pompan says it's time to start. According to the BMJ Quality and Safety Journal, 30% of all medical diagnoses are incomplete or inaccurate.
It's the 3rd leading cause of death in our country, medical error.
You should probably just start doing it.
Certainly not the case for the Hurwitzes. They say Uline and Pompan's review of the case helped at a time the family was reeling emotionally from the misdiagnosis.
Having somebody else take some of that worry and concern away to let me focus on the worrying that I should be doing.
Within 48 hours of consulting with her advocacy team, Hurwitz was given a new diagnosis and ultimately a future.
Thank God for them, because that's the only reason I went where I went and how things got fixed as quickly as it did.
So this is my beautiful wedding picture from 25 years ago. My husband is in the audience back there with my 2 children. What it shows you are the 4 people in my family who were misdiagnosed: my father, myself, my mother, and my brother. My father passed away in 2005, my mother in 2010, and my brother in 2012. I'm the lucky one. Most Americans will be misdiagnosed at least once in their life, and in my opinion, that's just too many times. As stated in the news report, misdiagnosis and medical error are the 3rd leading cause of death in the United States, behind heart disease and cancer. 20 million patients receive misdirected physician referrals every year, and that's primarily because their internists or specialists that they're seeing are just not aware of who to send them to. It's, again, not with any malintent. And 37% of patients, like in my own case, were managed by clinically inappropriate physicians. So I knew from my experience that on a daily basis I had to battle institutional politics, overworked schedulers, inattentive technicians, and even disenchanted physicians, just to protect my family. And I was lucky because I had the resources to do it. Medicine today is remarkably complex, with advances in treatment and biotechnology making it even more difficult to understand and navigate. So Clear Health Advisors is a company I started with a physician, Dr. Valerie Uline, and together we have a process. When we're introduced to, we call them clients, not patients, because even though she's a physician, we're not rendering medical opinion. We're only helping to empower with information and help navigate on their behalf. We have a 4-step process when we meet our patients. We collect all of their medical records. They are reevaluated to confirm that the diagnosis they think they have is actually the diagnosis they have, because as you've now all learned, 30% of the time they're inaccurate or incomplete. And then we identified the foremost leading expert for that specific diagnosis. And another myth that we've overcome is that getting a second opinion or going to a doctor that has a specialty in that specific area isn't any more expensive than going to the doctor you're currently seeing. How do you find out who the very best is for your diagnosis? We put a lot of research into that, and we have medical researchers doing the research, not kids looking up facts on Google or Wikipedia. We go into the research and we determine who has the most expertise in that area based on publications and past patient experiences and even insurance claims. And then the last step is that we inform the patients of their options, even when there aren't a lot of them. But as my partner's father, who's also a physician, Dr. Art Uline, always says, if you don't know what your options are, you don't have any. So we make sure that our clients are empowered to know what all of their options are and ultimately get better outcomes. So in closing, the solution, the healthcare navigation company that provides individuals with complex medical issues, comprehensive consulting and case management services. By doing this, we have improved outcomes. And if we can just help one person, we're happy. And you know, we don't always have happy endings because people come to us when they're very sick. But for me, I know that if you can give their patients, loved ones, family members peace of mind that you've done everything humanly possible, there's no price tag you can put on that. And now I turn it over to Dr. Tim Bain.
Okay, so every time Birdy speaks, I get a little verklempt. You like that word? Because it's a horrible thing that would happen to her family, and a similar thing happened to me. That's why I got into healthcare. Is my dad died from the treatment of heart disease, and I realized that what was happening in healthcare was that we really have a system that has been misnamed, and we have really what we have is a sick care system. And my goal coming into Brown was actually to create a paradigm shift in healthcare and bring together a healthcare system, a well-care system, an education-based system, which educates kids and families in what health really is so that we can keep people out of what I call the sick care system. And I think that's what we really need, is we need to start thinking a little bit differently. The thing that Brown did for me was to let me realize that part of the cost problem and access problem, and truthfully the quality problem, is not something that I can handle over the course of the next 2 years, but there were things that I could do within the framework of what I was trying to create and programs that I could put together that would get people to change what they were doing so that cost and quality and access would improve. And so one of the big things I did is I created a program, and I'm going to show you a little bit about that program when I was in Brown. My company's a little bit different than Birdy's. Mine really is about patient-centered care. We have in our company, we have what's called a personal client advocate. And we use that word client as well, because client is, in my opinion, a better word than patient. Because a client means that we wrap our arms around them as opposed to somebody that we have to take care of. And it's really a way of looking at the person in front of you and saying, I'm here to do everything that I can for you. And one of the struggles I had in my business was that when we had practitioners from multiple different modalities, they never talked to each other. So ultimately what I started to do was bring them in-house. So we started with just chiropractors. We moved into chiropractors, massage therapists, and physical therapists. From there we brought in physiatrists, who are medical doctors specializing in interventional procedures for joints. From there we brought in psychologists, and now we do interventional pain and minor surgeries. So our company has expanded. Actually, since we've been at Brown, I brought in a partner in interventional pain, and all of these things are starting to be put into one bucket where everybody's on the same EMR system so that we can communicate to each other, and in fact, we're also in the same hallway. So we actually talk to each other. And each person that comes in is put on a program. We first sit down with them with the personal client advocate and a doctor that sits with them, and they go over their entire health history. And then we say, okay, where are we trying to go? And we create a plan for them. And I think that if we don't have a plan, we can never get where we want to go. So our program is called the RIGHT system, and it's basically we re-educate the nervous system, we integrate their biochemistry, their nutrition, we generate tissue health, we heal their movement, and then we work on getting them to change their thought processes. Because one of the biggest problems in medicine today is that we're thinking about the problems that we've already created as opposed to figuring out how do we not have those problems in the first place. And if we do get them, how do we get back to health so that we can't have the problems that my dad had, where after he had his heart attack, medicine saved his life, but then we did nothing to tell him how to live his life so that he wouldn't have another heart attack or have further problems. And in fact, the drugs that he gave him actually killed him because they didn't explain to him, similar to Birdy's family, how some of those drugs affected other things. And so he died because of his other organs failing. And so what Brown taught me truthfully was, because I'm looking at myself as an entrepreneur, as Judy has said. So ultimately we need dollars. And in order to get dollars, we need programs. In order to create programs, we need to figure out what those programs were in the basis of cost, quality, and access, which is really the triple aim of healthcare. And I learned that here at Brown. I didn't know any of that stuff, truthfully. And I thought I was going to come here and I was going to teach everybody stuff, and I really learned a lot of really cool things. But what we did, we created a program which is an osteoarthritis knee program. And I created this program with the thought process that one of the most expensive things in healthcare today is knee replacement surgeries. And they're going up to the tune of $100,000, $125,000 for a knee replacement. And they fail about 3 out of 10 times. And there's complications about 7 out of 10 times. And so I thought, if I can get people moving without creating this massive expense, I could then change the way that they can do other things. And part of the problem that I think older people have is that when they don't move, their blood pressure goes up, their diabetes medications are not managed as well. So we created a program to deal with that, and that's what I first created at Brown. From there, we brought in interventional pain, where we're working to get people off of medications by doing procedures and then getting them into therapies and psychology so that they can talk about their pain, so they can get past that and get back to health of themselves. So this was my poster that I made when I was in Brown, and I just like it, so that's why I brought it. This is the program I created. Judy said it's just a commercial, and I said, yeah, but I created it at Brown, so I'm going to play my commercial so you guys can suffer through this, because it's pretty cool.
My knee pain kept me from enjoying life. My doctor advised knee replacement surgery. I wanted to avoid knee surgery because it doesn't always work. Then I found Bain Complete Wellness through a friend who had success with their innovative new procedure. At Bain, I got the knee pain relief I needed and was able to avoid surgery and get back to the things I enjoy. Don't let knee pain change your life. Change your life with Bain Complete Wellness. Bain Complete Wellness. Choose right now.
So that choose right now is our tagline. I'm a big believer in choice in healthcare. I personally believe that if you don't have the information, if you don't have the education, you can't make a good choice. And that's part of our problem. And so part of what I've been trying to work with is working with the schools. We're actually working with USF to measure. We learned about data-driven decision-making in school. Right, Judy? Right. And I didn't know any of this stuff either. But I realized that I needed to collect the data so that I could then tell other people about how they can manage these things in a little bit better way. So we're now working with USF and their School of Public Health to actually collect the data on our programs that we're creating that can show how people can get back to health and wellness. So we created this OA program. It's FDA approved. It's created and endorsed by Medicare now. It serves mostly the senior community. We started it out we copied what we did with professional athletes. Professional athletes get this kind of care all the time. And I was thinking, why can't we do this for regular folks? And so I was actually the first person that did this program in my company. And I now don't have any pain in my knee when it rains even. So if you guys want to hear about it, we can talk about it later, especially if you have good insurance. I'm just kidding. This is a joke. Yeah, cash too. So this is kind of my thought process. Our company we base everything off of the spine. I believe that the spine is the window into the nervous system. I am a chiropractor. I believe that there's a lot of things that we're just not really looking at, especially in medicine. We kind of poo-poo a lot of things. And I think there's a lot of things that if we open up our minds, maybe we can start getting people well and keep them well. I also believe that the most important thing we can do in healthcare today is change the paradigm so that we're actually educating kids about healthcare. So that 40 years from now, the kids are coming into the programs and they're not continually raising that cost structure. Because that's our problem is the senior community is so expensive to take care of. And if the senior community, we could kick that can down the road further and we could make it so that we didn't need to do all these expensive procedures because people were actually well, then we wouldn't need that. And the way to fix that is to change our education system. So this is the kind of the basis of my programming. And I appreciate Judy for letting me into this program because this has been life-changing for me. My wife wants me home, but I'm not sure why. So that's kind of what we're doing. And I wanted to talk a little bit about Birdy because Birdy had a patient, and one of the things that I think is really interesting because she said you should go first because you're going over the big structure, and then it comes down to kind of me finding the right people. But one of the things that is interesting is she had a patient in Florida, and that needed to be transferred, and because they were misdiagnosed at a hospital, and so she was able to then, from her Brown connection, she called me. I got her in touch with a neurosurgeon that I knew, who then talked to her doctor. They got the patient moved up, I believe, to Tampa General. They medevaced him up, and it saved his life. So this program saved somebody's life, really, literally saved somebody's life. And I think that's the key, is that relationships that I was talking about when I said, what is the most important thing about Brown? It's creating relationships that we're going to have for the rest of our lives that we can really change healthcare. So thank you very much.
Thank you. So should we give them degrees on Sunday? These were their critical challenge projects that they did while they were here at Brown, and we're so proud of them, and we're so happy that they're well on their way to success. So we wanted to leave time for all of you to ask questions. If not, I have hard ones, and Larry Chait, who's a faculty member of the program, I'm sure has hard ones. Yes, please identify yourself and to whom you're directing the question.
Thank you.
Thank you.
Is this on? I'm Anne Marie Price, class of 1995. Thank you all for your work. I think what you're doing is amazing. I've dedicated my career to healthcare advocacy, so I very much appreciate what you're doing. We are conditioned in our system by how we pay for things. How do you work within this paradigm? The cost, quality, and access. I've heard about quality, access. Can you tell me more how you work within that paradigm of cost, and in particular with insurance companies?
I guess I'll take that one because Birdy doesn't really do anything with insurance companies. It's a real problem. It's a struggle, truthfully. My company has been historically out of network because as chiropractors, that was kind of how things were done. When I partnered up with my partner a year ago, we started applying under a new tax ID number to get all of our stuff in network. We're now 1 year out, and we're still struggling to get all of our things in network because the insurance companies, although they say they want access, they don't really necessarily mean it. And even the plans that we are now on, some of the Obamacare plans are not included in your contracts. So it's a struggle, and it makes it so it's very difficult for patients. And I think, again, it comes down to patient advocacy. You need your patients to actually call the insurance companies to say, hey, I want to go see this doctor. But I think that's what we've got it. One of the things that this program was so neat about this program is that we had people from the insurance industry actually in the program, so we were able to brainstorm and talk things through. Part of the reason I was able to get some of the contracts quicker was because I used some of my contacts from Brown to actually get them to open up the policies. But it is a struggle. There should never be a struggle, in my opinion, to get a doctor contracted to take an insurance policy. That, to me, limits access, and I don't think that's fair for anyone in the United States.
I'd just like to add something. Our service is not covered by insurance. We're a brand new company. We've been in business less than 2 years because it all started at Brown. But we have collected data on the work that we've done, and we have, unfortunately or fortunately, we've been very busy. Based on the data that we have collected, we have a solid argument to propose to insurance companies that our service should be covered because so much of the costs that insurance companies are spending are because patients are ambling from one wrong physician to another. And if we can cut down on those costs, we make a significant difference to the insurance companies. So for us, it's about having enough data to support that argument, but we are definitely headed in the right direction, thankfully.
Thank you.
What do you charge for your service?
It's a sliding scale. We do a lot of nonprofit pro bono work for clients. We work with companies on a retainer basis so that they have access to us 24/7 for their employees, and they pay us a monthly fee. And truthfully, some months they come out way ahead, and some months we come out ahead. But for the most part, we have never turned away anyone. So we have a set fee for individuals who can afford to pay it, and if they can't, we serve them anyway. It's not a great business model, to be honest, as my husband, who's an investment banker, has pointed out several times. But we'll figure it out. If you do good, you'll do well, right?
Hi, Adam Leventhal, class of 2001. You talked a little bit about data. Can you talk about information technology systems or data systems that are missing from the healthcare system from your perspectives? Thank you.
Well, I think the biggest problem in healthcare today is data is not being collected correctly so that it can be utilized. So what I mean by that is that you've got private practice doctors using their own EMR systems. There's thousands of them out there. You've got hospitals that are struggling to use EMR systems. Each hospital is using a different one. None of them talk to each other. So you're getting some of these things where you're getting patients that are going in, they're having an MRI here, they're having an MRI here, there's so much of this doing things multiple times, doing the improper testing, not having the information when you walk into the hospital, that kind of stuff, just because the EMR systems don't communicate. And that, in my opinion, is the biggest problem in healthcare. Yes?
There's another one.
Oh, that's the next one.
Well, another issue is that what I've found is physicians, it's the only profession where they don't do conference calls. In every other profession, you bring all the parties together and you talk and you collaborate on a strategy. And in medicine, it doesn't happen, and I don't know if it doesn't happen because physicians are so busy trying to see as many patients as they can because they're being reimbursed so very little for the job they do, which is clearly a big problem. But one thing that we do is we go in and we coordinate for all of the physicians to speak to one another and come up with a collaborative game plan. And the physicians are often at different institutions in different states and different countries. So these systems, the EMR systems and the hospital systems, and even the wearables for heart disease or diabetes and all of the technology that exists, if the doctors aren't looking at it and really reading it and understanding it and looking at patient care holistically, they're useless. So I don't know if that answered your question about.
Hi, Gordon Fowler, class of '81. How much of the issues that you've spoken, Birdy, about misdiagnosis could be solved by GPs having more time and being paid a little better and the like, rather than sort of, changing the model per se?
I'm not sure. My misdiagnosis was in 2004, so I think the healthcare system has only gotten worse since then. But I do believe that if physicians had more time to review their patients' issues, that the rates of misdiagnosis may decrease. I also think that having the right doctor look over what your needs are, what your healthcare issues are, is imperative. And often people are being treated by inappropriate physicians for what they need. So, a tiny little story. I was misdiagnosed twice in a 6-month period as having a condition called Bell's palsy, which is, facial paralysis. It's a virus. It attacks your facial nerve, and like chickenpox, within 6 weeks you're supposed to get better. I didn't get better. So I went back, and I went to see the head of neurology at one of the finest institutions in California, and 6 months later, he told me once again, based on an MRI and a CT scan, that I had Bell's palsy, and I just had the very unfortunate case of Bell's palsy that I wasn't going to get better. And I believed him. I didn't question him. He was the head of the department, and it was by a happy coincidence that I ran into a friend of mine who's an ENT doctor who referred me to an expert who only focused on issues of the 7 cranial nerves. I had no idea what a cranial nerve was, let alone that there was a physician who specialized only in that. And so I walked into this physician's office armed with my MRIs and my CT scans, and I told my husband he didn't have to go with me because I knew he was going to tell me I had Bell's palsy. And it was 2004, so he put it up on the light box. They didn't use computers. And with a purple Sharpie pen, in 30 seconds, he circled my brain tumor. And the good news is, I'm here to tell you that story. The bad news is that I've been walking around with a brain tumor that had continued to grow for an extended period of time. And what he said to me is, I see how your doctor could have missed it. And if you had had a neuroradiologist review your MRI, he or she likely would have caught it. How was I to know that there was such a thing as a neuroradiologist? So there's an education piece that's missing for patients to be empowered to search out the very best care for themselves.
Just have a comment. Thanks for the presentation for both, but just to add on, I'm a physician, as a physician's perspective. So, when I see, I'm a neurologist, so when we see a patient, for me, what I'm thinking, if I spend more than 15 minutes on a patient, it's not possible. That's how the system works. Now, in the same time, if I order a nerve conduction study for somebody, that can be done in half an hour. That's equal to 6 times patient conduction. So that's where the system is more there for reimbursement for surgery and procedures, and less for human interaction. And unfortunately, the primary care physicians and some fields, psychiatrists and neurologists, a lot of them is not procedure-based. And so unfortunately, just don't have a lot of time to do it.
Right.
I would love to spend an hour with a patient, or 2 hours maybe, and get everything going, but the system is not allowing. That's unfortunate.
So now let me interject. You've just seen a little snippet of the Executive Master of Healthcare Leadership Program. Syed Rizdi is also a student, class of 2016, who will be graduating on Sunday. And the interaction that you've just seen among our students is very typical of the last 16 months during the program. And this is how we learn and share perspectives. So we don't have the answers yet, but we are confident that with caring, bright people who are now even better educated, well, we're going to get there. Thanks, Syed, for your comments.
May I ask Syed a question?
Sure,
Sorry,
you
am I
may,
going off
and then we
topic?
have another
Sorry.
question. But yes, Birdy, go
Well,
ahead,
I
please.
I'm hoping that I'm able to make a point here, so just go with this. Syed is a neurologist. He happens to be a foremost leading expert in MS. But my question to you is, how many patients that get sent to you, referred to you, all have MS? Are you sometimes sent patients that just have neurological issues?
Yes. Yeah, so I would say in my practice about 85% are MS. But to your point, every year there's a lot of patients I see who've been treated for MS for years and don't have it. And some of it is what you're dealing with, is a gray zone. Some of it is incompetency. I mean, it's not one thing you can identify. It's a lot of things. But I do see a lot of MS patients, but some of these patients actually want to have MS, they want to believe they have MS.
But only by seeing somebody with your expertise do you drill down and determine what the appropriate care is.
You have to see a lot of patients to get the experience.
Right.
It doesn't happen overnight.
Right.
Please.
Half class of 71. I just wanted to share that I'm working for Senior Link, which provides in-home, round-the-clock care for elderly and disabled by getting Medicaid to reimburse the caregivers and reimburse our company for the support of a nurse and social worker. We call them consumers, not clients or patients. And we have about 3,300 on under care, or looking to grow to about 10,000. We're already in 6 states. And part of what we've done is identify people that are at risk for falls and put a program in place to intervene for fewer falls. We've got the fall rate down to 20% of that in nursing homes.
Wow.
And our next big initiative is working on better dementia care.
Thank you.
That's fantastic. Extraordinary. Thank you.
I have a cost question for you. I've owned a healthcare finance business since 1989, and one of the changes in the new healthcare system is because insurance policies have changed, the deductibles that are now associated with individuals have risen dramatically. Kind of on the order of, it used to be maybe $500 was your deductible, it's now rising up towards $5,000. So the implication of that for who pays is pretty dramatic. If you do the math, it's hundreds of billions of dollars. We'll now have to go to people who are out of pocket, and they'll have to pay directly. So the question I have for you is, have you seen any impact in that in your business today, and what might it be in terms of the kind of care you can give, and specifically, are people backing off a little bit because they cannot pay?
Yeah, absolutely. In our business, on the therapy side, you would see people would kind of finish their programs, get through 16, 20 visits, which is kind of what they needed for certain things. When they had knee replacement, they may need 30, 40 visits. Today, they back off. Like that. We used to average around 16 to 18 visits per physical therapy patient. Now that average has dropped to about 6, and I think it's directly related to cost. The cost shifting has happened on the physician side and on the patient side, obviously. On the procedure side, one of the things that's happened is people are waiting to get their procedures. They're waiting to get surgeries till they've met their deductibles. We've actually had to create plans where they can pay almost like going to rooms to go. They've got these credit plans that you can do where you get no interest financing kind of stuff. The problem is people have to qualify for them, and a lot of those patients can't qualify. So the doctor's left holding the note at that point, and it's a struggle to the physicians because where you used to have the money coming in, a lot of times now you have to factor your money and be able to live that way.
Right. We have a program that actually solves all that. I'll talk to you about it.
All right.
Please.
So I don't even work in healthcare. I'm an IP lawyer, but when as a patient, I can tell you that there's no project management in medicine. There's no other industry where anybody seeks to do something as large as what doctors try to do with a patient where there's no person who is managing the project. And I applaud what you're doing because you're slapping a project management system on top of it. But it seems to me like the project management belongs in the healthcare system. And I think we've identified the reason that it's not there is that the money isn't there. The doctor can't do it because he's not paid for doing project management. And nobody's health insurance is going to pay for somebody to walk you around and to pull all the information together. So the medication, this medication is counteracting that medication thing. I mean, that happens, as far as I can tell, routinely. So I'm wondering, is there anybody in your program who's kind of looking for ways to stick the project management system inside the healthcare system? I mean, is anybody talking about those kinds of things, or is it all sort of, let's put Band-Aids on the outside?
No, that's actually what our personal client advocate is they're there to collect everything and manage all the different physicians. Now, the hard part is if they get hospitalized,
right,
then you end up with a hospitalist who is the hospital's answer to a primary care physician,
right, exactly,
who doesn't actually, most of the time, make the phone call. So you have to have that advocate inside of the private practice that's doing the work, calling back and forth and doing these calls like Birdy had said, which is getting people on the phone, and that's pretty tough in the hospital
It's
system.
impossible. And you know, we're all sitting here, I'm a Brown graduate 81, my guess is everybody in this room is several standard deviations above the average IQ. And I mean, I think about, well, no, but I mean, like, I think about when I deal with problems like this in a world, at least I have that going for me. I mean, you know, you talk about the resources that you had. Yes, I have money, I have friends, and I have my inherent ability to understand complex problems. What if, you know, you're just a normal person? And I don't see, like I said, it needs to be built into, you know, when you go and buy a car, they don't expect you to go and buy each piece of the car and then figure out a way to put it together. They sell you a car, and there's somebody inside the car manufacturing facility who knows how to put a car together and then to get it to the people who want to buy it. And that is completely missing in medicine. So that, like, if I were going to join your program, that's what I would want to do, is figure out a way to incorporate that into the financial structure of healthcare delivery.
So
anyway.
We can totally support that. We do.
She should apply.
We do encourage both transformation for people to become leaders and do what they want to do, but we always have our eye on the systemic transformation that you're talking about, and we couldn't support you more. And we're hoping that although everyone has a project to do individually, they do work together. And in fact, we work in teams throughout the program. We switch the teams up, so everyone's working with everyone else. So yes, we do. We're very hopeful that we'll be able to create a transformed healthcare delivery and financing system. You're entirely correct. We all agree with your assessment of the problem. Christine, another member of the class of 2016.
This was a shock. In my first semester, on campus, I went up to Judy. I said, I have a little issue. I'm 45 and I'm a geriatric mom to be, so here I am. But I'm sorry I'm late. She was napping, Tim and Birdy. But I know what your conversation was about. And I'll say one thing. I was just in Washington with some congressmen on the Hill. We were talking about breast cancer, you know that. And it was amazing to me that ASPS was there, American Society of Plastic Surgery, exact same thing. The numbers were astonishing for minorities and many other women, but more so minorities, that when they get breast cancer, it's far too late because they don't have the resources, they don't get their mammograms, and it was just horrendous, the stats that they put up on the board. And it's really, if we could have more people like Birdy out there, I think we could help breast cancer and the mortality rates go down. So thank you, Birdy, for what you do.
Well, thank you all very much. I appreciate your time, your interest in our program. Maybe we'll take this one last question.
I just have a question. question.
Sure.
First of all, I just wanted to say thank you for both of your presentations. I really enjoyed listening to both of them, and I really appreciated you extrapolating your personal experiences into the presentation. So I have a question for Birdy. My mother was diagnosed with a terminal illness back in 2007, and I was doing my master's at the time from Boston University in healthcare communication, and that program was all about patient advocacy. That was really the gist of that whole program that I was in. And I took care of my mother, and throughout the process, her 2-year battle with cancer, she was not misdiagnosed, but she had a lot of unnecessary tests that she had to take, and there was a lot of, obviously obstacles and problems and issues that I saw with the healthcare system that, could have improved her care. So my question for Birdy is, where do you see your company 5 years from now? And what can you do to make this service that you have available to more of the population so that more people can benefit from the kind of optimal care that you give to patients? How can more people, more of the population benefit for something like that? Because we need every person who gets diagnosed with some really awful illness needs to have the best and optimal care that they can possibly get. So that's my question to you. Where do you see your business 5 years from now? And
Well, I'm not clairvoyant, but what I hope is the argument that we intend to make to insurance companies to cover us will allow many more people to have access to the service we provide. Obviously, we need to grow our business internally so that we are well-equipped staff-wise to serve a larger population. And the retainer clients that we have, the big institutions that pay us on a monthly, retainer fee to help serve their employees will also provide access to a greater population. So we have different ideas on how to grow our current business, and whether that's hiring additional physicians or creating satellites of me and my partner in Boston and in San Francisco and in Chicago. I mean, there are unfortunately many people that have lived your story and have lived my story and had Tim's experience that are wanting to help people navigate. So it's not like it's going to be difficult to find people. We have physicians calling us all the time saying, if you ever need anyone to render second opinions, or so how we're going to grow will be a matter of which course we decide to take, whether we're just going to invest in ourselves and staff up and put our own money into it, or we get the insurance companies to agree, or the companies that are paying us on a capitated basis will offer us the opportunity to staff up.
So
It's not really a solid answer, but she does have on the best sandals in the room. I have to point out.
Well, thank you very much, all of you.